Hi, this is Dr. Jonathan Yousef, Networking for Your Optimal Health. The goal of this podcast is to optimize your health. To achieve this goal, I'm going to discuss the most common medical concerns that I find in my practice. The objective is to take the top 5 medical issues that my patients complain of, and I will create a podcast for each one of them, providing just a little more information during their office visit. The series is intended to supplement a regular office visit for my patients or for any listeners, and to get a little bit more insight into their medical health. Hey, this is going to be in the comfort of your own home or car. Without further ado, hi, this is Dr. Jonathan Yousef, and this is Optimizing Your Medical Health. This is part of my healthcare series where I'm discussing different medical conditions that are common in my medical practice, and this topic is about high cholesterol. High cholesterol is referred in the medical community as hyperlipidemia. So you might hear me say hyperlipidemia, and that just means high cholesterol. Also, you might hear me say something like coronary artery disease, and this essentially means that there's a blockage of the tubing or the blood vessels to your heart, and this blockage can occur from high cholesterol. So basically, the high levels of cholesterol in your bloodstream can build up and cause plaque, which can reduce the blood flow to the heart. And in some cases, it reduces it so much by blocking the blood that it blocks the oxygen going to the heart and can cause something called necrosis or death of the tissue. If this occurs and it's bad enough, well, this is what leads to a heart attack. And obviously, this is still one of the most common causes of death in our country. So my goal today is to discuss how do we reduce our cholesterol? One, by looking at some dietary and physical activities, as well as some supplements. Of course, there are medications, and the biggest ones are something called statins. Statins are, for me, one of the has some concerning side effects. And if you look at the research behind them, while they do have a great deal of ability of reducing your cholesterol, they do have also some reported side effects of muscle aches, liver enzyme elevation, and there's some cognitive functions or memory functions that are researchers are still sort of looking into these side effects and seeing if the benefits outweigh the risk. Right now, it seems to be in the medical community confidently felt that these statins do help in your heart health. But today, I'm going to focus mainly on your diet, exercise, and supplements that I recommend. So the confusion in a lot of patients, so you receive your blood work and you see high cholesterol. Well, let's just say you have high HDL cholesterol, and H is what I refer to as happy. Well, you're in luck, because the HDL cholesterol is good cholesterol. And if your cholesterol is a little high because of HDL, well, that means your body is able to take some of those bad cholesterol, the LDLs, and remove them out of the system. And the LDL is your bad cholesterol, and I use L for lousy, so H for happy and L for lousy, just as a quick reminder tool. And it also helps when you're looking at your blood work to figure those out real quick. Well, there is another one on your blood work, and if you're looking at it, you might see something called triglycerides. Triglycerides is a different type of cholesterol, and luckily it's not as bad as the LDL, but still, unfortunately, we are dealing with something that can block up your coronary arteries. So what do I like to do about triglycerides? Well, first I explain to the patients that this is not quite like when you are eating meats and you look at the package insert and it has fats and are also high in cholesterol. So, but the triglycerides specifically, and I kind of break them down into 4 dietary food groups, and they are rice, pasta, breads, and sweets. Those are just like simple sugars, and obviously those are things like cakes and candy and so on. But there is one other possible cause of high triglycerides, and that is from alcohol consumption. In fact, I had one young patient who had been partying the night before. He did some blood work. He came back over 500 on his triglycerides. I was quite surprised because I thought he had some serious medical condition, and sure enough, he told me that he was drinking the night before, and we repeated it, and it was less than 150. So to my surprise, he was able to bring it down all the way, and that was just because he had a heavy drinking night the night before. So I asked my patients to avoid alcohol, especially the night before their blood work. Not only can it bring down up their triglycerides, but also their liver enzymes. So the basic information I want to tell my patients regarding diet and exercise is, well, low fat, low cholesterol diet. So how do I know what's low cholesterol? You look at the package insert. It has high levels of cholesterol, but those cholesterol levels are saturated fats. They're full of fats. Oh, that's ugly. And so you want to try to avoid heavy, saturated, high cholesterol foods. You want to go with unsaturated fats or polyunsaturated fats. And you want to try to avoid certain types of oils. And a quick note is coconut oil is a big favorite of some of these health gurus, and unfortunately coconut oil does have high levels of cholesterol, and my patients have come back with high levels of triglycerides. High levels of total cholesterol, as well as bad cholesterol from ingesting too much coconut oil. So again, just keep things in moderation. It's not a bad oil. I do find other benefits to it, and in fact, I've had I still use that in some of my cooking, but I do avoid it in large amounts. In addition, I also recommend a high fiber diet, of course, and the high fiber includes like oatmeals and nice healthy whole grains. And I want to try to avoid those simple carbs, those ones that the breads and the white breads, those refined carbs are not good for you. So keep those. Keep the high fiber, but avoid those bad or refined carbs. In addition, I do recommend exercise. I'm a big believer in increasing your activities. I have some different rules of thumb in regarding how we should recommend exercise. My recommendation would be to consider 30 minutes 3 to 4 times a week, and to try to reach a good 60% of your maximum heart rate. So I use everybody uses a little different method, and I do a quick 220 minus your age, that's being your maximum heart rate. Not too many people use this, but I like to use this. And then I take 60% of that, and that's kind of where I like to be. Where I'm at is usually somewhere between 60 to 80% of that. I think that when your endurance picks up, you'll find that it's hard to reach that kind of heart rate, but in the beginning you are going to notice a quick increase in your heart rate until your body gets accustomed to it. So take it slow, take it easy, start walking. I do a walk to run for some of my patients who can tolerate it, but just start doing some basic exercise, and probably start with maybe a couch to walk if if that's a good start for you, and then go to a walk to run type activity. And some other things that I like to incorporate is weights, and I do a few light weights with certain maneuvers, and I would like to share those with you if you want to talk about some more things in my office. For right now, I would like to also divulge into 2 types of supplements that I recommend. Well, let's start with fish oil, because that's one of my favorites. I take 2 grams. You can take up to 4 grams. I used to take 4 grams of fish oil. The reason why I reduced it was because I did not notice that much change when I went from 2 to 4, and I had some reasonably good outcomes with 2, so I wanted to reduce the amount per day. However, one of the 2 things that you want to look at when you pick a supplement is that you want to make sure that it's good of omega-3 fish oil, and you also want to make sure that there isn't other fish oils that are in there that are not healthy, and you want to look at the DHA and the EPA. So there has been some research that shows that DHA can increase your bad cholesterol, so I want you to look into that a little bit. There is a product and a prescription product that only has EPA. For right now, I'm going to avoid talking about prescriptions, so I want you to consider 2 grams of fish oil because it can also help with some other things, including hair and skin, as well as joints. But again, that's off-label, and the research is still up in the air about it. I would like to also look at niacin, which unfortunately I'm not a big fan of because of the flushing side effects, but I do find that it is very helpful, and I used to take it. The only concern that I have is that because of the flushing, I had to stop. But for some patients, it doesn't bother them, and the flush-free kind has some question of its efficacy. So I've used the flush-free kind as well, and don't know if I would say negatively about it because there are some indications that the niacin still has some good effects. So I would suggest 500, 750, or 1,000 of fish oil, and I think that you would find a great deal of benefits. I'm sorry, of niacin, and I think that you would find a great deal of benefits that way as well. Finally, I would like to end by looking at red yeast rice and coenzyme Q. I'm not quite sure. I've had some patients take those, and there's some back and forth regarding the efficacy. I think red yeast rice has had some close relations to the statin family, and so some people have recommended it. I'm still up in the air about it, but what I would recommend is fish oil and niacin for right now, and exercise. The coenzyme is great if you're taking a statin. I don't know of how much effect does it have to reduce your cholesterol, but I think that it definitely is recommended for patients who are taking statins. So definitely talk to your doctor about coenzyme Q10. And thank you for joining us for another discussion of our health series, and this one is specific about high cholesterol. We'll look to join us for another topic if that medical condition is pertinent to you. Thanks again. This is Dr. Jonathan Yousef, networking for your optimal health.